Hello, AARP North Dakota members, friends, partners, and others interested. I'm AARP North Dakota State Director Josh Askvig, and I'm here today to talk about Vital Voices, a comprehensive AARP research program that collects and shares state-specific data that helps identify issues that matter to North Dakota's older adults. In 2023, AARP conducted a survey of 703 people over the age of 45 in North Dakota, and I'm super excited to talk about the health impacts today with Dr. Aisha Bonner Cozad, who is a Senior Research Manager with AARP. Aisha, good to see you as always.
Good to see you, Josh. Thanks for having me.
Awesome. So talk a little bit about what did we find out about the health concerns of North Dakotans 45 and older?
Sure. Well, no surprise. Issues around healthcare and healthcare access have just skyrocketed over time, especially in response to the pandemic. In our Vital Voices survey for North Dakota, we see that 91% of respondents said that having adequate health insurance is important to them. The importance of being able to afford healthcare expenses, we see 89% of people said that was important. 83% said paying for prescription drugs. And both of these data points have increased since we did this survey in 2020, and they went up by 8 points. So that's probably the sort of best indicator of what we're seeing, how the pandemic has really changed a lot of things in our life. To see an increase of 8 points on a topic that generally has a high degree of importance to people, right? Staying healthy is important. That's pretty telling.
Yeah, that's what jumped out at me too when you and I talked about this survey data was some of the other data points are important, but to see those two areas specifically about the growth in people concerned about costs of healthcare in general and specifically about prescription drug costs. Are there any other insights about these data points, Aisha, that you think are important to point out?
Well, I pointed out the heightened awareness. That's certainly something to keep in mind. And the increased emphasis on affordability, both in terms of healthcare expenses and prescription drugs, just again points out that people really understand that the impact of their healthcare cost is a major consideration for their financial health. And I think particularly now in our society, as we really recognize how important it is to stay healthy so that you can have a long lifespan. The importance of this issue is just going to continue to grow. And again, I think this is a clarion call for policymakers, for businesses, for HMOs, and for individuals to really focus on how do we reduce cost? How do we make sure people have access? How do we make sure that we're baking in healthcare access as we age in our country?
So I think that's a great pivot to what AARP does with this information and how AARP North Dakota uses this work. And specifically, we last legislative session in 2023, we were fighting to lower prescription drug costs in the North Dakota legislature, getting a bill passed that would limit out-of-pocket insulin costs for public employees in North Dakota with a goal of going back to the next session and trying to expand that to the general market on insulin costs and also looking at other ways to put downward pressure on prescription drugs. We also in North Dakota supported federal efforts to lower prescription drug costs between Medicare negotiation and some of the other discussions that are happening at the federal level. And on that healthcare access issue, one of the things that we know people have a ton of questions about is about navigating Medicare and enrolling in Medicare and what that means. And so we held Medicare enrollment sessions. We partner with the state of North Dakota and others to help folks understand as they're approaching Medicare and those decisions, how do they figure out what's going to be best for them and their family. So Aisha, thanks for joining me to talk about the health data that we found in the Vital Voices survey. It's good to talk to you.
Great to talk to you too, Josh. Thanks for having me.